Hello, this is Dr. Stanley Lang. Welcome to this video. The topic is on how to have a healthy gastrointestinal biome and why that's so critical. I want to tell you a story about a patient that I saw today, which was the first time I saw her in follow-up from about 4 weeks ago. And this is a patient that was profoundly ill for the last year. I saw her as a new patient 4 weeks ago. And part of her story is that she went into liver failure because of a drug that she was taking, a common drug that's over the counter. I'm not going to give the name just to be a reminder that over the counter medicines aren't necessarily safe, and a lot of them are quite unsafe. And this patient went into liver failure because of this medicine. And then she went through a long, harrowing journey that was in the hospital for months and eventually got better. And now, or at least when I saw her last time, she had had several months of very severe fatigue, barely can do anything, and just feels bad all the time. Now, when I say she got better, I mean she got better enough to go home. But she was still not herself, not anywhere near functional. And when I saw her the last time, part of the story that was the most important to me that stuck out was not the liver failure, but the story about her having been on multiple antibiotics during the time that she was in the hospital because different complications happened that required treatment. And I'm not faulting the antibiotics. I'm sure that they were needed at the time that they were given. But there's a problem that happens when you give antibiotics, which is that it severely disrupts the balance of bacteria that live in us and on us. And the ones that live in us are called the gastrointestinal biome, the ones that live in the GI tract, that is. And so this patient's biome was severely disrupted. And over the last 3 years, I've really been refocusing or changing my focus on understanding that getting the biome right is like the foundation of all good health. And if I want to help somebody with their heart disease or their diabetes or their arthritis or their Lyme disease, I still need to work on the biome because that's like the foundation of the house. And an analogy that I give patients all the time is that not working on the biome and trying to work on this other problem is kind of like working on the second floor of your house where there's a crack in the wall, and it keeps opening up and you keep trying to patch the crack. And down in the basement, one of the walls is caving in and you're not doing anything about that foundation. And that's a little bit what it's like dealing with chronic disease that many people in the United States have some type of chronic disease. Dealing with chronic disease without paying attention to the biome is like trying to fix the wall of a second floor room while you're not paying attention to the foundation of the house. And so we focused on the foundation, and I gave her some strategies that are the things that have evolved as standard practice for my office now. But I'll give you I'm not going to go into all the details, but basically it comes into 3 major things. First of all, you have to stop poisoning the system. And so that means cutting out the chemicals that are causing problems, especially the worst one, which is glyphosate, which is the main ingredient in Roundup. And glyphosate is on pretty much everything because it's contaminated everything in North America, at least in the United States. But it's much more heavily present in certain foods, like GMO foods and grains. And so cutting out that chemical and other chemicals is the first thing. You have to stop poisoning the system. The second thing that is important is you have to start putting good bacteria back in the form of fermenting foods and not just probiotic capsules. That won't work to restore your biome. And I won't go into all the details why that won't work, but without consuming a wide diversity of probiotic foods, most people will not get their biome back where it's supposed to get. And there's a lot of reasons for that I won't go into. You can either accept or not that idea, but at least I've given you a trail that you can start pursuing, that you can start doing on your own, because this is not rocket science. but it does require concerted change. And the third thing, there's some critical nutrients that are important for the biome to recover. And one of those key nutrients is called fulvic minerals, which is spelled Fulvic, fulvic minerals, not folate, not folic acid, fulvic minerals. And there are a variety of different forms out there. There's one particular brand that I think is the best, and so choose wisely. But these are critical for the biome recovery because these minerals help the humic minerals that are in the fulvic products help the biome to talk to itself. And if you don't resupply these critical nutrients, the ability for the biome to recover is really limited. So this patient came back today and she said she feels great. Now, there's a lot of ways that she's not where she wants to be, but compared to where she was a month ago, she feels great. Now, this is somebody that has felt really bad for way over a year. And the point being that with this relatively small shift in focus and a few things that she's done consistently, she's already recovering her health. So there is hope for good health when you do the right things, and it's pretty hopeless if you don't. And the right thing always is working on your biome to have a good, healthy biome. So I hope you have found this to be helpful. I wish you well. God bless and have a great day.